With all the ignorance that's going on in the world, I didn't know how to deal with it, so I wrote an infomercial for ignorance. And here it is. Are you suffering from terrorism? Do you wake up in the morning, afternoon, or night seeing Asian? Are you fearful of Mexicans and borders being placed in the same sentence? Does the smell of curry remind you of body sweat? Do you find yourself clutching your purse and walking past a black guy? If so, you may be suffering from what is known as ignorance. I and the people at Get With It, it's 2013, would like to announce there is a cure. We understand that ignorance is a serious illness that affects teenagers and adults alike. It does not discriminate, however, the people suffering do. In North America alone, there is said to be nearly 200 million people that live with ignorance. Unlike other illnesses, people surrounded by ignorance often receive what is called unnecessary animosity generating resentment syndrome, or for short, mad hate. So I and the people at Get With It, it's 2013, would like to present a cure to ignorance that is natural, affordable, and has been around for centuries. Knowledge. And knowledge has been proven to relieve severe cases of ethnocentrism, racism, and has been extremely effective in removing certain stereotypes. If you suffer from illiteracy, sexism, homophobia, others, make sure you contact your local librarian and read the necessary text required before moving on to a high concentration of knowledge. Be sure not to mix knowledge with conspiracy. The effects are unknown and have yet not been proven. When consuming knowledge, seek quiet space, finish knowledge directed, and do not step unless otherwise stated. See, me and my partners that Get With It, it's 2013, can guarantee knowledge works, but we can't guarantee it to you, so here are a few testimonies. You know what? I always want to know why black people love chicken and watermelon so damn much. But thanks to knowledge, I don't waste my time on silly things that taste good because they do taste good. I focus on how the government can help provide for my kids. Hi, I've always wanted to bomb Iran, and knowledge helped me realize I didn't even know what Iran was. But now I do. But thanks to knowledge, I don't want to bomb them anymore. Side effects include tolerance, understanding, admiration, including risk or generosities not foreseen. Love and pride are rare but have been noted in some cases. Other side effects include mind being completely blown as to how you've never realized life without ignorance. Ask yourself if knowledge is for you. If so, get some. Thank you.
I want to thank Addie and Ahmed. Isn't Ahmed incredible? Woo, woo. For organizing today. I particularly want to give thanks to Dr. Houston and Dr. Ruth Wolf and Shana McNeil, who you'll hear from in a minute from the Medical Students Association. We did a forum with Dr. Houston a few months back, and he's definitely a hero of mine. He's standing up for all people who are in this country, as we all should. I don't know how many of you are aware, but there's something called the Jordan's Principle. And the Jordan's Principle came about because a young Aboriginal child died because the federal and provincial government continued to fight over who should pay for his care. We don't want to have an Ahmed's Principle, do we? So it's time for both the federal and provincial government to step up to the plate and make sure that everyone that we welcome to this country and to this province will receive the care that they need. When we signed on to the international agreement that we would welcome refugees to this country, isn't it absolutely logical that we would welcome them here and give them all the services that Canadians have access to? We fought in this province against two-tiered health, right? Who here fought against two-tiered health? Well, right now, the federal government is offering three-tiered health care to our refugees. Absolutely reprehensible. And so, as the doctors mentioned, we have this scenario where refugees are coming into our healthcare system and being, turned away because they may well have health care, but they don't know what, category of refugee you are. Absolutely reprehensible. When we signed on to the UN Charter, we signed on to abide by the rule of law. International agreements and treaties are part of Canadian law, and therefore the rule of law requires that we live up to our responsibilities and obligations to extend equal health care to the people who have been welcomed to our country, who have suffered persecution, suffered terrorism, suffered all kinds of threats. And as an Albertan, I am standing with those here today who are calling on this provincial government, as the Saskatchewan-Manitoba government did, in the interim, until we can turn around this federal government, or in 2 years become the federal government, so that refugees will be treated with the due respect that they should be accorded. So thank you. I'm standing here today as my New Democrat colleagues are right across this country. We will continue to fight for this. What is reprehensible, that when we stood here a year ago, that we would have to come back here for another year and fight for decency in this country. So thank you for turning out. One thing I ask of you, as soon as you get home, or if you've got a BlackBerry or a phone with you right now, email the Prime Minister, Jason Kenney, and say, we aren't standing for this. We want you to reverse those cuts immediately. Thank you very much.
Hi everyone. I'm sorry I'm not good like him, so some of you would have to forgive my French. So, my name is Jean. I'm among the lucky ones who benefit from the IFH program. So I know how it is to come here as a refugee, and you come here with nothing, you start a new life, come with your children. You know, when I get here in 2009, it was hard. Every day I have to be at emergency clinic because my kids get sick every day. But without IFH, I don't know what I was going to do about it. So refugees come here, most of them, they was born refugee camp. Other one, they spend half of their lives in a refugee camp. Some of them, as it was said before, they have never ever met a doctor. They have never ever met a nurse. They don't know how a doctor looks like. All of them, sorry about that, all of them, they are sick. I can say it like that. And they don't know it. They have some diseases they don't know about. For example, I can tell you from me, I came here, I was in good health, I was okay, but I went through all screenings, tests. I was told that I have TB virus. I say, what? I don't smoke, I don't drink, how come? I was not aware of that. I went through 9 months treatment medication. Without IFH, for sure I was not supposed to be here. Maybe I was supposed to be 6 feet under. Maybe I was supposed to be in a boat somewhere. So that's because those refugees survived a lot of things. They survived bomb, they survived bullet, they survived knife, bayonets. It doesn't mean that they can survive it here. What we need here is to help them, to hold their hands, because they're like babies. They're still crawling. What they need from the government is to hold their hand, let them make that first baby step. As soon as they make it, let it go. They will walk on their own. They will pay that life insurance for themselves. But it's hard to come here. You can imagine when you moved from your father's house. How hard was it? It was very hard. You can imagine moving from one country, one continent to another one. You come here with nothing. You come with your family. You don't have a job. The money government gives you is nothing. You can't even survive on that. And then you will have to pay your health care thing, I don't know. It's hard for refugees, and I don't know how they will survive. I was the lucky one. I benefited from the IFH, but I don't know if the other one can survive without it. So I want to ask everybody here, or even the Prime Minister or somebody, can your family survive? Can your family live without life insurance? They need to ask themselves that question before they make that decision. Can my family survive without it? If your family can't survive without it, refugee families also can't survive without it. Or maybe they say, okay, they can survive anything. They survive the bombs, they survive the bullets, they survive refugee camp life, they can survive this. No, they can't. It was not their choice to survive it. They was forced to. Most of those refugees, they come from Globe South, where they live under $1 a day. But when their children get sick, they have to pay more than $200 in order to get treated. They don't care about them. You can see their wife is pregnant, is on labor. They don't care. You have to pay before your relative get treated. You don't pay, you will die here, we'll take the body and go and bury them. Is that the situation you want to put them into too? Yeah, there is many reasons why the refugees come here. But there is two main reasons. Their security and the health for their relatives. If they don't give them that, why they have to come here? So I can leave that message. Ask yourself, my family can live in that condition. Another message I can pass, please, the refugee want you to hold their hands, help them to make that first baby step. Let them go to school, let them learn language, let them know the country. And they will survive without it, but help them to make that baby step. There is a lot of message to be passed on, but the time is short. Maybe we can come back next time and continue this. Thank you so much.